how do you decide what treatments to recommend?
The treatment for different forms of vascular anomalies rely basically on the type of the malformation. Different types, as you know, requires different types of treatment. One of the basic factors to determine the timing and the extent of treatment is the burden on the patient, symptoms. So certainly symptoms will decide and prioritize the areas that we have to target with the treatment and the timing of the treatment. Smaller malformations will require less work, logically, compared to larger malformations. So preparing the family to the longer treatment time for those extensive malformations requires the discussion and sometimes reviewing the imaging studies with the family and explaining to them the internal changes that may require numerous interventions. And sometimes these patients will have a very long, if not lifelong, relationship with the interventional radiology, where treatment is done as needed. Most of the time is done on a schedule, where we schedule serial procedures to target the malformation. And for the larger ones, it's difficult or sometimes impossible to treat the entire malformation in one session. So triaging and itemizing the malformations or the parts of the malformations that need to be treated is done based age, extension, and symptoms. Certainly this is decided after a discussion with the family or the patient. So it's directed by the immediate needs of the patient, as sometimes the needs of the patient are different than making the decision just based on a clinical exam or an imaging feature. For example, the larger lesions may not be the first one that the patient would prefer to treat. And there's also some psychological and emotional impact in the decision which ones to treat. So basically, you listen to the patient first and then triage the treatment of the malformation, which can take, as I told you, a long period of time.